Hey folks, Dr. Sean Bryant back here again with E3 Chiropractic and Wellness for another episode in our Common Running Injuries series for the month. This week we're going to be going over a super common condition that gets frequently asked about in clinic here, and that would be iliotibial band syndrome, or IT band syndrome. So the IT band itself is a really interesting fibrous structure that runs along the outside of our leg right here. It's really interesting because it's actually an aponeurosis, which is like a muscular tendon, but it's actually in a sheet-like distribution, a really thin sheet-like distribution, as opposed to a rope-like tendon. So the strong band of fascia that the IT band is actually originates from three muscles on the lateral aspect of our hip. That would be the tensor fascia lata muscle, the gluteus medius muscle, and the glute max muscle. This band of fascia envelops these muscles, then runs down the outside of our leg and then attaches to the outside of our knee. It has two different attachment points, one that's a little bit higher on the lateral aspect of the femur and one a little bit lower on the lateral condyle of our tibia. Now, runners who typically experience IT band syndrome will describe this as a pulling, burning sensation, most often at the outside of the knee, a little less frequently, a little bit higher just on the outside of the thigh. So typically runners who exhibit IT band syndrome-like symptoms, or that pulling, burning sensation along the outside of the thigh, they have a tendency when they run to collapse their stabilizing hip. So during the stance phase of their gait cycle, this opposite hip will collapse. We create a little bit more internal rotation of the femur in towards our knee, and that actually creates a really large compressive force on the outside of our thigh along that IT band. It was previously thought that IT band syndrome was caused from the IT band snapping back and forth over top of a bony prominence on the outside of our knee. More recent studies show that it's actually that compressive force on the outside of that thigh as we put compressive forces through it. So most people, when they have this syndrome, they kind of jump to the foam rolling stage. They have a tendency to go, hey, I need to stretch out the IT band, so let's foam roll it out. They hop on, they foam roll, and the IT band itself is actually extremely rigid and not responsive to stretch at all. It's pretty comparable to Kevlar, actually, which is the material used in bulletproof vests. So it is tough. So if the aim is to reduce tension along the IT band, foam rolling it itself is not going to be an effective strategy. A more effective starting point, what you could do is start to tailor your treatment or the stretches to the muscular components of the IT band. So the tensor fascia lata muscle, the gluteus medius muscle, and the glute maximus muscle, stretching those out to kind of reduce the irritation along the IT band. Once we've kind of addressed that muscular tightness component to it, we want to start, again, stabilizing that hip abduction component to our running cycle. So a really easy setup that I like to give patients is going onto an elevated surface. I've got two plates here. You can use a stair, you can use a bench, you can use a box, whatever it is. We're going to stand up nice and tall, hips level, and I want you to control the lowering of that hip, placing a nice stretch on the outside of the hip. And then we're just going to lift up using our glute muscles and controlling this motion back and forth here. This will help us kind of stabilize these muscles and reduce some of that compressive forces in our stance phase as we run. Hope this helps, and happy running, folks.